Here's my audience. Thank you. Cancer, infectious diseases, obesity, and SIDS are all terms none of us want to associate with infants and young children, especially our own. Breastfeeding can reduce the risk of serious health issues in both mother and baby. Therefore, techniques need to be implemented that will increase the numbers of mothers that are breastfeeding. I have seen these results firsthand and have done hours of research on my own over the last 6 years, and I know if educational programs, proper training, and support were implemented and mandatory, we would see an increase in the numbers of nursing mothers. I'm going to explain the benefits of breastfeeding. I will review the decrease in numbers and why it is happening, and I will show how, through proper education and training, as well as strong support system, what will allow for these numbers to rise. Breastfeeding provides amazing benefits for infants. In the textbook, Nutrition and Applied Approach, Thompson and Monroe explain that evidence has found breast milk is superior to formula. Breast milk allows for better absorption of nutrients, and the contents and composition of breast milk changes for the baby's needs. So say the baby's sick, the mother's body is going to sense it, and the mother's body is going to produce antibodies and give them to the baby to help them fight that sickness. Ergo, breast milk provides protection from infections, allergies, and residues. It has also been found in Thompson and Monroe's textbook, as well as other reputable sources, that breastfed babies have higher counts of bifidobacteria and lower counts of infectious bacteria, and that breastfed babies have lower rates of respiratory tract, GI tract, and ear infections. The benefits of breastfeeding are clearly amazing, but the numbers of breastfed babies decrease significantly within the first year of life, leaving babies more susceptible to the harsh conditions around them. Dr. Allison Stu stated in her peer-reviewed article, "The risk of not breastfeeding for mothers and babies. When infants are not being breastfed, they are being deprived of essential nutrients that may result in health issues such as diabetes, obesity, and SIDS. The number of breastfed babies rapidly decreases after birth. According to the CDC, 80% of mothers breastfeed at the time of birth. That number is cut in half at 6 months of age, and that number decreases even more to less than a third of that 80% at 1 year of age. These numbers are completely unacceptable considering the World Health Organization suggests that you breastfeed your baby for the first 2 years of life. Studies have shown that breastfeeding mothers decrease so rapidly because of the lack of support they receive. They are receiving little to no support and education while in the hospital and upon their arrival home, and they're receiving even less support once they arrive back at work. Now that I have told you about the benefits of breastfeeding, how significantly the numbers decrease and why it is happening, let me tell you how we can get the numbers of nursing mothers rising or at least staying steadily the same. Through a strong support system and proper education, as well as personal liabilities, these mothers are bound to increase in numbers with not only your help, but the help of their surrounding communities. Every strategy I'm about to propose to you is 100% backed by the CDC. It can be found in their journal, Strategies to Prevent Obesity and Chronic Diseases, article titled, The CDC Guideline to Strategies to Support Breastfeeding Mothers and Babies. Strategy 1. We need to modify our maternity care practices within the hospitals and birthing centers. By doing so, they need to have a written breastfeeding policy that is routinely communicated to all healthcare staff within the facilities. They need to train this healthcare staff in necessary skills to implement these policies. All pregnant women need to be informed about the benefits and management of breastfeeding. They need to help mothers initiate breastfeeding within the first hour of the infant's life. They need to show mothers how to breastfeed and how to maintain lactation even if they are separated from their babies at any point in time. Given They need to give newborn infants absolutely no food or drink other than breast milk unless it is medically necessary. Mother and baby need to be allowed to be together 24 hours a day while they are in the hospital. They also need to refer mothers to breastfeeding support groups upon discharge. It is noted in a Cochrane review of study designed to evaluate the effectiveness of interventions to promote the initiation of breastfeeding, found that changes in maternity care practices effectively increased breastfeeding initiation and duration rates. The next strategy proposed is support for breastfeeding within the workplace. This is crucial. I experienced horrible support from my previous employer when I went back to work after my first child. Never got time to pump, produce milk, nothing. Terrible. Anyways, they need to educate employers on the state and federal laws of what they have to do to support these breastfeeding mothers. A lot of people are unaware. They also need to give mothers options for returning back to work, such as part-time or extended maternity leave. Dr. Lacey Gregory, MD, a family practitioner, says she would like to see all mothers not return to work for at least 12 weeks postpartum, but sees them go back as early as 4 weeks postpartum. So this is terrible because these breastfeeding mothers, once they return back to work, she sees the numbers decrease to at least half once they return back to work. The fourth strategy would be to provide access to breastfeeding education and information. By working with childbirth educators to include evidence-based breastfeeding education curricula, and working with health plans to encourage them to routinely offer prenatal and breastfeeding courses. Another Cochrane review looked at 5 studies involving primarily low-income women, and it basically showed that through support and guidance, the numbers of these women increased tremendously. The last bit of strategies I'm going to suggest are social marketing as well as the marketing and formula. Local experts need to be found that can pitch and promote breastfeeding as a good thing through social media, through the television. You constantly see ads about formula or coupons for formula you get in the mail when they find out you have a baby. They're basically deterring you away from breastfeeding your baby and promoting formula, knowing that breastfeeding is superior to formula. Excuse me. For example, upon discharge at the hospital with all 3 of my children, they send me home with a big cooler bag full of formula samples. It's crazy. As I had previously stated, all of these strategies I propose to you are 100% backed by the CDC, and there has been evidence reviewed through places such as Cochrane Review that shows that these would be successful if implemented everywhere. Today I have explained the importance of breastfeeding. The benefits are clear. The risks of not breastfeeding are terrifying, and you can now see that through education and a support system, how this could be more effective. The facts are there. Now we need to stand together with the government and push to make this the most effective it has ever been.